Hello and welcome. My name is Christy Roby-Williams, Director of Muscatine County Public Health. And today we're going to talk about COVID vaccines. As more people start to get vaccinated against COVID-19, there are a lot of questions that we are all asking. So today we will answer some of those questions in partnership with you. Please remember that there's a lot of research happening right now on COVID-19. Both the disease and the vaccine. Information may change as quickly as it comes out, as scientists and as officials learn more about it. For the most up-to-date information, please ensure that you visit the CDC's website. This is our one true source in the Public Health Department, and what we always encourage and guide people to when they ask questions about COVID-19. We want our county to know that vaccines are limited. Muscatine County Public Health is required to follow guidance from the Infectious Disease Advisory Council, also known as IDAC. IDAC recommends that in the initial phase of the COVID-19 vaccination program called Phase 1, or you may hear us call it Tier 1, 1A, or Phase 1A, vaccines should be offered to healthcare personnel and long-term care facilities. So with that, Muscatine County Public Health will follow the guidance from IDAC and the Iowa Department of Public Health to ensure that those at high risk of COVID-19 are vaccinated. As we receive more vaccines from the state, additional groups will be vaccinated according to guidelines. Muscatine County Public Health and other county officials are promising to communicate clearly when we have additional knowledge on what each group, who they are, and when they can receive the vaccine. Please know that we are on a vaccine shortage order from the state of Iowa as of right now, and we cannot go through any of our additional phases until we receive guidance from IDAC and the Iowa Department of Public Health. This video is recorded as of January 7th, 2021. By the time you see this, things may have changed. So we will continue. Please visit cdc.gov for the most up-to-date information, and we'll continue to commit to giving you the best information based off of the knowledge we receive. So the first question that we have received is the COVID-19 vaccine safe? There's a lot of uncertainty around this. It's new, and so we want to provide you with the answers to that. Both approved COVID-19 vaccines from both Pfizer and Moderna have been studied and approved by the FDA as safe for individuals 16 and older. If you have any concerns about getting the vaccine, please talk with your healthcare provider and process it with them. Clinical vaccine trials for children are ongoing. Currently, though, the CDC and Advisory Committee on Immunization Practices, they do not have any recommendations for COVID-19 vaccines in those under 16 years of age. Our next question is, can I get COVID-19 from the vaccine? Great question. Both vaccines approved in the U.S. are mRNA vaccines. This means there's no live virus in the vaccine, and you cannot get COVID-19 from any of the approved COVID-19 vaccines. What you may receive is a reaction to the vaccine, and that is your body doing what it is supposed to do. And please know that some of those reactions are very normal as your body builds immunity to that COVID-19 vaccine. The next question would be, should my child be vaccinated? At this time, there is no COVID-19 vaccine approved, as mentioned, in the U.S. for children under 16 years of age. However, stay tuned. We anticipate in the local public health department that this may change as further science is completed. So some folks can have an allergic reaction. So our next question is, what if I am allergic to the vaccine? You are allergic to any ingredients in the vaccine or have a history of allergic reactions to vaccines. Again, please talk to your healthcare provider before getting vaccinated. The CDC at this time does not recommend the vaccine if individuals are allergic to it. So when you come to get a vaccine in any of the points of dispensing that we will continue to roll out in the county, we will be able to provide you with the information about what is in the vaccine. So please stay tuned for that. Our next question is, how many shots of the COVID-19 vaccine do I need? So as of this time, both approved vaccines in the U.S. are given in 2 doses a few weeks apart. One is 21 days apart and the other one is 28 days apart. The first dose helps your immune system to receive and recognize the virus, and the second dose really strengthens your immune response. So you need both shots to be effective. Our next question is, do I need to wear a mask when I get my vaccine? Our answer is absolutely, most definitely yes. The CDC recommends that people wear a mask whenever they are in public or a healthcare facility. Ongoing wearing the mask helps prevent the spread of COVID-19. And at this time, we don't know if once you get a vaccine, can you still be a carrier of the virus. So it is vital that we continue mask wearing to help protect the general public and our most vulnerable populations. Our next question is, will I need to pay for the vaccine? Our answer for you to that is the COVID-19 is being distributed at no cost. However, vaccination providers will be able to charge an administration fee for giving those shots, but they will not turn away anybody that cannot afford that administration fee as long as the vaccine continues to be distributed by the federal government. Our next question is, who should get the vaccine first? So our answer for that is vaccine supplies are limited. The CDC has made recommendations on who should be offered the vaccine first, with healthcare workers and long-term care facilities being part of that phase 1A. So please note each state has their own additional guidance on who should be vaccinated first to ensure that effective vaccination and distribution. When more vaccines are available, more people will be offered the vaccine as soon as possible. We anticipate this process to take probably timeline within the next 6 to 12 months. Next question. If I already had COVID-19, do I still need a vaccine? The answer to that is anyone currently infected with COVID-19 should wait until they have recovered to get the vaccine. Current evidence is showing and suggesting that people who have recovered from COVID-19 within the last 90 days can delay getting vaccinated until the end of the 90-day period. The CDC still recommends that people who have had COVID-19 in the past and have recovered get vaccinated. So yes, it is important that you still get your vaccine when it is ready for you and available. Our next question is, do I still need to wear a mask and avoid close contact with others if I have received 2 doses of the vaccine? And as previously mentioned, yes. The scientists are still learning a ton about the vaccine and how it protects against COVID-19. It is important for everyone to continue social distancing and wearing masks while more people get vaccinated. Again, we want to support and protect the overall health and well-being of everyone in our county. So our next question is, when can I stop wearing a mask and social distancing? After I have been vaccinated. We all just want to get back to that normal, right? And the answer is, we don't have enough information at this time to know exactly when the CDC will stop the recommended mitigation efforts such as masks and social distancing. It is safest to continue those practices of social distancing, wearing a mask, and washing your hands even after vaccination to protect yourself and your loved ones. So our next question is, what % of the population needs to get vaccinated to have herd immunity to COVID-19? So what in the world is herd immunity? You've probably heard it, that term mentioned in the news or in different media sources. Herd immunity is when a large enough % of the population is protected against a disease, so the disease cannot spread easily to those who are not protected. At this point, scientists are not sure what percentage needs to be vaccinated to reach herd immunity with COVID-19. Some diseases require a higher % of people who are protected than others. Our next question is, when will I know when I can be vaccinated? And this is one that we have received many inquiries about. as we continue to receive the information from the state, the Iowa Department of Public Health, who is receiving it from the CDC. Muscatine County Public Health and other county officials, we are all committed to getting every resident who wants the vaccine vaccinated. We are committed and promise to communicate with all county officials, healthcare providers, media, directly to the public when more groups are eligible to receive the vaccine. So watch our Facebook page. We're posting on the Muscatine County website, and we'll be releasing information to all of our media sources in our county and newspapers. While vaccines are limited and we're under a shortage, Muscatine County Public Health is required to follow all of the guidelines on who is vaccinated first. As more vaccines become available, more individuals will be vaccinated as soon as possible. You can check the resources in the description to learn more about vaccination guidelines provided by the CDC and the Infectious Disease Advisory Council for the Iowa Department of Public Health. Please expect information and guidance to adjust as scientists and professionals learn more about COVID-19. Everything in this process is subject to change. For the most up-to-date information, please visit cdc.gov and type in COVID-19 vaccine into the search bar. The CDC is Muscatine County Public Health's one true source for information on COVID-19 and COVID-19 vaccine facts, along with the guidance we receive from the Iowa Department of Public Health. You can follow Trinity Muscatine Public Health on Facebook and Instagram for constant updates and education and information about COVID-19. Thank you so much for joining us today, for being with us as we answer your important questions, and we will continue, as I said, and are committed to giving you the updates as we learn more guidance for our county.